I was born and raised in Pakistan, and almost 75% of those surveys said that they were taught alternative medicine very poorly. So I didn't have a clue what they're talking about. We had quite a bit of resistance, and people were skeptical, and still there are some. But when they saw the interest of the students, we had, even though it was an elective course, we had more than 50% of the class coming and taking that course. Hello, my name is Mushtaq Emeritus from Washington State University. It is my pleasure to have my good friend, Dr. Francesca Zimmerman, veterinarian from Switzerland. We both run YouTube channels, and we live in different parts of the world. So we decided to collaborate and share our experiences, backgrounds to our global veterinary community. So I welcome Dr. Zimmerman and let her take over from here on as a host for today's conversation. Welcome, Dr. Zimmerman.
Hi. Yeah, hi from me as well. And I'm so excited to sit here with a true icon in veterinary medicine and science as well. So Dr. Mushtaq Memon is working in veterinary medicine, also in veterinary science, in reproductive veterinary medicine, and also in traditional Chinese medicine. So that is a very rare combination, and I'm so fascinated by it. So that leads me to the first question, actually. Since you had such a diverse career and also an international career, can you quickly take us through your path, your career? I'm really wondering how you get to become a professor in Washington State University.
I was born and raised in Pakistan. This is where I received my veterinary education as well as master's degree. So I was curious to get more education. So I ended up coming to the United States, end up at Iowa State University. I spent about 2 years doing research in reproductive physiology, but really did not excite me that much, sticking my head in the lab and trying to look at the tubes with some fluid in it and trying to figure it out, how many things are in it. So pretty quickly it dawned on me that I'm the kind of person who needs some interaction with people, working with animals. So to cut long story short, I was managed to transfer my PhD studies to University of Minnesota. So this is where I finished my PhD in theriogenology under supervision of some very competent people. And from there on, I did my residency training in University of Illinois in Urbana-Champaign, and that was in food animal medicine and surgery. This is what I wanted to be. But anyway, so you never know. Things change in life, and so opportunities came around, and I got my first faculty appointment at Oklahoma State University, then moved to Louisiana State University, then to Tufts University. And part of the reason was not that I was not able to keep my job, but my wife was a physician, and she needed to do some trainings as a foreign medical graduate. So she was able to accomplish quite a few different things. So from Tufts University, I ended up at Washington State, where I spent almost 25 years. So it has been a very, very nice journey to go through. In this way, I was able to also do quite a few international assignments.
Wow, yeah, that is quite a career, actually. And I am also fascinated because you're combining research, teaching, and TCM, Traditional Chinese Medicine, into one thing. But I'm wondering, research and TCM, TCM is a very empirical-based method in comparison to research in veterinary medicine. So how do you reconcile these two? And before you answer that question, how did you discover TCM in the first place?
It's a very good question. I was serving as the chair of the curriculum committee at the veterinary college at Washington State. So they do every 5-year survey of the graduates to find out, what Washington State did good, what did it bad, and how could we improve it. So as the chair, I received all those surveys back of the graduates from 2000 and 2004. And almost 75% of those surveys said that they were taught integrative medicine or holistic medicine. Some people call it alternative medicine very poorly. So I didn't have a clue what they're talking about. So we had a holistic club, a student club of the students. So I talked to their president. To cut a long story short, they invited speakers in TCVM and happened to be from University of Florida, Dr. Shea, and then another lady from Sacramento, California, Dr. Bibi. So they came and gave us some run through on TCVM, and so it was kind of very interesting. As a curious person, so I wanted to learn more. So I discussed with these people. I said, how can I learn more about it? So I was suggested maybe I should take, course in acupuncture. So this is what I did and became certified in veterinary acupuncture, and then try to combine that with my reproduction and other clinical practice at Veterinary Teaching Hospital in Washington State. So this is how all the story of TCVM started.
Oh, wow. Yeah, also quite a journey. But so how did you combine those two? I mean, traditional Chinese medicine and Western medicine, it's sometimes difficult to balance, or did it bring you into difficult positions sometimes?
I realized that to make it work, we need to have some kind of special course. So we designed one credit elective course for veterinary students, and then also created a clinical practice rotation in the teaching hospital in acupuncture and TCVM. We had quite a bit of resistance, and people were skeptical, and still there are some, But when they saw the interest of the students, we had, even though it was an elective course, we had more than 50% of the class coming and taking that course. And so one thing led to the other. We, at Washington State, as we speak, they have one associate professor. She does nothing but integrative veterinary medicine. There were regular blocks of the students going through their service. So to cut long story short, yes, when you believe in something and you think that there is some benefit, which I thought that it has a place. It has a place in veterinary practice. So that's what I did, and I'm very pleased with the outcome of it. And still, I'm not done yet. I'm still working on it in different ways.
That's so great. And how did the students react to the course? Did they like it?
Many of them do. Students as young people are very curious. They want to know, what else can they do? So once you show them and then also give them hands-on practice experience, they really like it. But the veterinary faculty who are specialists many times in their own area, they could be difficult to convince, and I know that I'm one of those people that I love my own specialization of reproduction, but at the same time, I'm still open-minded. That's all I ask the faculty member. I said, please be open-minded, listen to me, and see if it makes sense to you, and then we could work together. So I think we have a very large number at this time, faculty members in the United States who are certified now in veterinary acupuncture, rehabilitation. So I think this struggle is paying off.
For sure. But I also know that you are an author in numerous publications. So did you also have aha moments with, for example, TCM? Did you have a special case that underlines that?
Some unique cases. This one case comes to my mind, and this dog was going through, she had, I think, lymphoma, as I recall. She was going through some chemotherapy as a female dog. So they, thought that this animal is getting very depressed, not eating. Maybe TCVM could help. So I got involved, and I did some acupuncture treatment with this animal in about 2 sessions. To my surprise, this lady, the owner, came with the dog, and dog was really very active. And she came that she couldn't control herself, the lady, the owner. She said, do you know, Dr. Memon, what she did? I said, what did she do? She said, she ran up the stairs and she ate her full meal. I mean, you could see I was looking at the dog, looking at the owner. I said, who's more happy, So this lady was so happy that it just really dawned on me. I said, it's not only the animal, but we are also making some difference in the emotional situation and setup in the owners. Because see, these animal owners are not really anymore just owning the animal. The dogs and cats are there with them in the family, in the house, so they become family members. So those kind of cases really make your practice worthwhile.
Yeah, it's a big gift you can give to the pet owners for sure. Yeah,
Yeah.
such a wonderful story. Um, and you also were in advisory roles quite a bit. Were your recommendations influenced by TCM as well?
Yes, it did. It did. It still is happening. I did, and for recently, day before yesterday, I received an email from Hong Kong, where I had spoken to students in Hong Kong University, the veterinary school. And this student got so inspired that he wanted to do some survey of the TCVM practice in Hong Kong, Taiwan, and China. So I was just scratching my head. I said, you see, I just was with them for a few hours. So this is how it happens. So then I try to guide the student and then try to do a few things. Same thing we are doing in Turkey, we are doing in China. So many activities are going on, all over the world.
You think that TCM also can be introduced in everyday practice then, when you see your progress with all the teaching of TCM?
Definitely, definitely. TCVM, as you know, is almost like a separate type of medicine, and it has all these acupuncture, herbal therapy, food therapy, massage, what they call tuina. So this is almost like a separate discipline of medical practice. So today, as we speak, we are very comfortable saying, that you can combine Chinese medicine with Western medicine, for the betterment of patient. And the thing is, our Western medicine has done outstanding job. All the diagnostic, your radiography and your imaging, CT scans, and emergency type of treatments and surgeries, they're all from, Western medicine. But when it comes to older animals with chronic problems, then I think there are some limitations in Western medicine, and then acupuncture, herbal therapy do quite a bit. So I think I'm very comfortable saying there are some times that we have to be careful where we should do acupuncture, not do acupuncture, but most of the time it is very compatible, if you will. So we can use it as a complementary with the Western medicine.
So, as I understand, when we have, for example, CT scanners and stuff like that in Western medicine, I mean, it's rated as high quality medical approach. Do you think also TCM can get or will be labeled high quality medical approach in the future? And what has to happen for that?
When I talk about combining, we are talking about a partnership almost between, our Western medicine and DC. Why I say that? The Chinese folks, when they started practicing acupuncture and herbal therapy, they didn't have a clue what's going on inside. They couldn't see it, should I say it that way, You brought about CT scan, MRIs, which is an expensive technology. So today, I think it's even easier to practice TCVM when you can see it. But now you can see what's going on in the lungs, how damaged they are and what could be done, what's happening in the kidneys. How could I design, my protocol with that? So that's exactly what's going to happen. So I think, we don't want to keep them separate. I mean, there are some veterinarians who practice nothing but only traditional Chinese medicine, which is okay. But I think my perspective is that we ought to combine that and see what is the best for the patients.
So, when we're looking back to your career, do you have some significant moments that you want to share?
Well, still, I get very excited, with the students, with the future of veterinary medicine. And this is why it takes me, to different veterinary colleges here in the United States. I'm on the road quite a bit here in the US and also overseas. As we speak, next month in May, I'm in Turkey. So I have to go to 5 different veterinary colleges in Turkey and talk to those students. And, I'm so very excited, look forward to working with them and going around and, talking to different, students. So it becomes very challenging as well as very interesting. Last time when I was at University of Istanbul, I spoke in English, obviously, because I don't know Turkish. But the colleague of mine, even though many young people knew enough English, but the faculty and the dean insisted that there should be Turkish translation. So there was simultaneous translation in that way, So it just depends where you are. The same thing happens, I was last year in China. After, we were together, then I went and visited about, I think, 8 or 9 different faculties from south up to the north of China. And there it was almost required that, there has to be a translation, in Chinese. So with those, I think I just feel very excited. That's what's keep me going, in fact, in my age and this stuff, because I get very excited to see where the future is going, how I can help to maybe influence that future in a positive way.
Oh, that's so cool. So you're still very active, but do you have any plans for the future for more specific achievements that you will, yeah, want to achieve?
Yes, activities are going on as we speak. I have, a gentleman from South Korea. He gave a presentation in China when we were together, and he was so impressive that I asked him, I said, how about if you write a paper on it? So I have worked with him since the last 3 months, and we have a very nice paper on feline rehabilitation, acupuncture. He's a surgeon, so we have submitted that paper, for refereed journal. So, before then, about a year ago or so, we published a first book on integrative veterinary medicine. So now I have taken back seat. I'm not trying to be a first author on these things, but I'm trying to encourage others, to be first authors or whatever. So these are the things that, keep me going, and I hope to continue that.
Oh wow! So you make everybody step up a bit. That's very, very nice of you. And if you would start over or had the chance to start over, would you take the same path?
Yes, I have no regrets. Some people think that, well, I should have done. I mean, there are so many things that I could have done and differently, but the path I went through, I think, has been just outstanding. It has given me exposure to not only United States, but so many other countries. And because of that, going to different countries, understanding the culture, understanding the norm, how these things work, that makes it easy. And then, my observation is that when you are sincere, when you show people that you are trying to have their betterment, people welcome you. And I think this is life is all about. How can you make a difference? How can you influence the positive things in future? So I really look forward to continue that. So I'm very happy at this stage and whatever I've been able to, accomplish.
Yeah, well, your way of thinking is very inspiring, especially in this comment you just did. And yeah, so I want to thank you for sharing your career, your path, your insight, your passion, everything. And yeah, out there to the viewer, if you have any questions or comments to Dr. Memon, then please let us know down in the comment section. So maybe there will be a Q&A later on. And yeah, thanks for joining us today.
Thank you, everybody. And then please look forward to seeing you again. As Dr. Zimmerman said, we will have a series of these videos, and now we'll be focusing more on specific our discipline, veterinary medicine, TCVM. So don't miss it. Go ahead, and if you like it, subscribe it, and we will see you soon. Thank you.
Thank you so much.
Bye-bye.